Hello everyone, I'm Laura Syron, President and CEO of Diabetes Canada. By now, you've likely heard about Bill C-64, an Act Respecting Pharmacare, which was introduced by the Government of Canada back in February of this year. This legislation is set to create a framework for a national pharmacare plan, including coverage for diabetes medications. We at Diabetes Canada applaud this initiative as there is an urgent need to help people living in Canada with diabetes who are either underinsured or uninsured to access their life-saving medications. With broad consultation, engagement, and careful implementation, this bill could significantly reduce barriers to those people accessing diabetes medication. However, there are areas in the legislation that need improvement. The government's draft formulary for diabetes medication is limited, excludes several key treatments, while includes outdated products. Our consultations with individuals who live with diabetes, our partners and stakeholders, have expressed real concern about this. To address this, we've compared the proposed formulary with the medications in our clinical practice guidelines and the non-insured health benefits plan, and this comparison has highlighted some gaps. To ensure Bill C-64 truly benefits those living with diabetes, we have three primary recommendations. The first recommendation is to emphasize comprehensiveness and choice. The government should utilize our evidence-based clinical practice guidelines and develop a more comprehensive formulary. This must involve consultations with people with lived experience, healthcare experts, provinces, territories, and Indigenous communities. Diabetes management is not a one-size-fits-all approach. Personalized care is essential. Each person with diabetes is unique, and healthcare providers need a range of effective interventions to tailor treatments. The second recommendation is to ensure continued improvement in access and care. It's crucial that our healthcare system keep pace with the new and emerging innovations to ensure all people who live with diabetes have access to the best possible care. That's why we encourage the government to adopt a principle of continued improvement of care and access. And our third and final recommendation is to provide for robust and fulsome consultation. Before Bill C-64 receives royal assent, there must be thorough consultation with all relevant stakeholders. This consultation should include the development of real and practical scenarios regarding the impact of the proposed plan. C-64 needs to protect those with existing coverage while ensuring those who struggle to afford their medication do not get left behind. In closing, Diabetes Canada believes it is not too late to get this legislation right. With broad consultation and engagement and careful implementation, this legislation could represent a significant step towards improving access to better diabetes care.